Okay, let's talk about something that affects an enormous number of men over 40, and almost nobody talks about openly. Not at the pub, not with friends, barely even with the doctor. And if you're watching this, either you're experiencing it yourself or you love someone who is. Either way, you're in the right place. Because today, I'm going to explain exactly what's happening, exactly why it happens after 40, and exactly what the research says actually works to reverse it. No embarrassment, no judgment, no awkward medical jargon, just facts, science, and genuine solutions. Stay with me. Quick note before we dive in. I'm not a doctor, nothing here is medical advice. Always check with your healthcare provider for anything specific to you. And on this topic especially, please do. Okay? Let's go! Let's start with the basics, because I think a lot of people, men and their partners, have an incomplete or slightly wrong picture of what erectile dysfunction actually is. And understanding it properly is the first step to addressing it. Erectile dysfunction is defined as the consistent inability to achieve or maintain an erection sufficient for satisfactory sexual activity. The key word there is consistent. Occasional difficulty is completely normal for virtually every man at some point. Stress, tiredness, alcohol, anxiety can all cause temporary issues that mean absolutely nothing. ED is when it becomes a pattern, a recurring experience rather than an occasional one. And here's the first thing I want both the men and the partners watching this to understand. ED is not a character flaw. It is not a reflection of attraction or desire. It is not a sign of weakness. It is definitely not something to be ashamed of. It is a medical condition with identifiable causes, and in the vast majority of cases, especially when caught and addressed after 40, it is genuinely reversible. How common is it? More common than most people realize. Studies suggest that approximately 40% of men experience some degree of ED by age 40. By age 50, that number rises to around 50%. By 60, approximately 60%. The correlation between age and prevalence is remarkably consistent, which means if you're a man over 40 experiencing this, you are not alone. Not even slightly. You are part of a very large, very silent majority who simply don't talk about it. And if you're a partner watching this, understanding that your partner is dealing with something that affects nearly half of all men his age is important. This is not about you. This is biology. And it's fixable. Here's where it gets really interesting and really important, because the causes of ED after 40 are not what most people assume. Most men assume ED is primarily a psychological problem, performance anxiety, stress, mental health, and while those absolutely play a role, they are rarely the primary cause after 40. The primary causes are almost always physical, and specifically, vascular. Let me explain. An erection is fundamentally a cardiovascular event. It requires adequate blood flow to the penile tissue, blood vessels relaxing and dilating to allow increased blood flow in response to arousal signals from the nervous system. After 40, several things happen simultaneously that directly impair this process. Cause number 1. Reduced nitric oxide production. Nitric oxide is a molecule produced by the cells lining your blood vessels. It's the primary signal that tells blood vessels to relax and dilate, allowing increased blood flow. It is absolutely essential for erectile function. After 40, nitric oxide production naturally declines. Your blood vessels become less responsive. Blood flow efficiency decreases, and the cardiovascular mechanism that produces an erection becomes less reliable. This is why ED is now recognized by cardiologists as one of the earliest warning signs of cardiovascular disease. The blood vessels in penile tissue are smaller than coronary arteries, so they show signs of vascular dysfunction earlier. ED after 40 is sometimes described as the body's early warning system for heart health, which makes addressing it not just a quality of life issue, but a genuine health priority. Cause number 2. Declining testosterone. After 40, testosterone levels naturally decline by approximately 1 to 2% per year. By 50, many men have significantly lower testosterone than they did at 30, affecting libido, energy, mood, muscle mass, and erectile function simultaneously. Low testosterone doesn't always directly cause ED, but it significantly reduces sexual desire and arousal response, which makes everything else harder to overcome. Cause number 3. Inflammation and metabolic changes. Chronic inflammation, which we've covered extensively on this channel, directly damages blood vessel walls and impairs nitric oxide production. Insulin resistance, increasingly common after 40, is one of the strongest predictors of ED. High blood pressure damages blood vessels throughout the body, including those responsible for erectile function. High cholesterol causes arterial plaque that restricts blood flow. Cause number 2. Declining testosterone. After 40, testosterone levels naturally decline by approximately 1 to 2% per year. By 50, many men have significantly lower testosterone than they did at 30, affecting libido, energy, mood, muscle mass, and erectile function simultaneously. Low testosterone doesn't always directly cause ED, but it significantly reduces sexual desire and arousal response, which makes everything else harder to overcome. Cause number 3. Inflammation and metabolic changes. Chronic inflammation, which we've covered extensively on this channel, directly damages blood vessel walls and impairs nitric oxide production. Insulin resistance, increasingly common after 40, is one of the strongest predictors of ED. High blood pressure damages blood vessels throughout the body, including those responsible for erectile function. High cholesterol causes arterial plaque that restricts blood flow. Every metabolic health issue after 40 has a direct pathway to erectile function. They are not separate problems. They are the same problem expressing itself in different ways. Cause number 4. Medications. This one surprises a lot of people. Many of the most commonly prescribed medications for over 40s have ED as a side effect, including certain blood pressure medications, antidepressants, antihistamines, and cholesterol medications. If ED started or worsened after starting a new medication, that conversation with your doctor is worth having. There are often alternatives. Cause number 5. Psychological factors. Stress, anxiety, depression, and relationship issues all genuinely contribute, especially after 40 when life pressures often peak. Performance anxiety creates a vicious cycle. One difficult experience creates anxiety about the next, which makes the next more likely to be difficult. The mind-body connection here is powerful and real. Addressing the physical causes without addressing the psychological component, or vice versa, often produces incomplete results. I want to pause here and speak directly to the partners watching, because this section matters enormously. When a man experiences ED, the most common reaction from partners, even the most loving and supportive ones, is to take it personally, to wonder if they're still attractive, to question the relationship, to feel rejected. Please hear this clearly. ED after 40 is almost always a physiological issue, not a reflection of attraction, desire, or love. The man experiencing it is almost certainly more distressed than you are. The shame, embarrassment, and feelings of inadequacy that accompany ED are profound and genuinely devastating for most men. They are unlikely to be talking about it. They are almost certainly suffering in silence. The most powerful thing a partner can do is create safety. Safety to talk about it. Safety to seek help. Safety to address it without fear of judgment or rejection. Research consistently shows that men whose partners respond with empathy, patience, and active support are significantly more likely to seek treatment and significantly more likely to respond well to it. Your response as a partner is genuinely part of the treatment. Practical things that help. Initiate the conversation gently and privately, not immediately after an incident, not in a way that feels like criticism. Just an open, loving acknowledgement that you've noticed, that it's okay, and that you want to figure it out together. Reduce performance pressure wherever possible. Anxiety is one of the most powerful suppressors of erectile function. An environment of acceptance and patience is genuinely therapeutic. Attend a doctor's appointment together if he's willing. Many men avoid seeking help because of shame. A partner's presence and support can make that step significantly easier. Okay, solutions. And I want to be very clear here. These are evidence-based lifestyle interventions that research shows can genuinely improve or reverse ED, especially when the underlying causes are vascular and metabolic rather than primarily psychological. They are not a replacement for medical advice. They are what the science says works alongside appropriate medical care. Natural fix number 1, cardiovascular exercise. This is the single most evidence-backed intervention for ED after 40, and the research is genuinely impressive. A comprehensive review published in the Journal of Sexual Medicine found that aerobic exercise, walking, jogging, cycling, swimming, significantly improved erectile function in men with ED, particularly those whose ED was linked to cardiovascular risk factors. How? Exercise directly increases nitric oxide production. It improves blood vessel flexibility, it reduces inflammation, it lowers blood pressure, it improves insulin sensitivity, it raises testosterone, it addresses virtually every underlying physical cause of ED simultaneously. 40 minutes of moderate aerobic exercise 4 times per week. That's the dose the research supports. Not marathon running, not brutal gym sessions, just consistent moderate cardio, 4 times a week. The improvements in erectile function from this intervention alone, in multiple studies, were comparable to the improvements seen with ED medication. From exercise, free, no prescription required. Natural fix number 2, the Mediterranean diet. The Mediterranean diet, rich in vegetables, fruits, whole grains, legumes, fish, olive oil, and nuts, has more research behind it for ED than virtually any other dietary intervention. A landmark study published in the American Journal of Clinical Nutrition found that men following a Mediterranean-style diet had significantly lower rates of ED than those eating a Western diet, and that switching to a Mediterranean diet improved erectile function in men who already had ED. Why? Because the Mediterranean diet directly addresses every vascular risk factor associated with ED. It reduces inflammation, improves blood vessel function, raises nitric oxide production, improves insulin sensitivity, and supports healthy testosterone levels. The 3 superfoods we covered in our last video, blueberries, fatty fish, avocado, are all core components of the Mediterranean diet. Your gut health, your cardiovascular health, and your erectile health are all responding to the same dietary signals. Everything is connected. Natural fix number 3. Optimize your sleep. We did a whole video on sleep, link will appear above, but its relevance here is critical. The majority of testosterone production occurs during sleep, specifically during deep sleep cycles. Consistently poor sleep directly suppresses testosterone levels. Studies show that men sleeping less than 5 hours per night have testosterone levels equivalent to men 10 to 15 years older. After 40, when testosterone is already declining, poor sleep accelerates that decline dramatically. Optimizing sleep is not optional for men concerned about ED after 40. It is foundational. Natural fix number 4. Address the metabolic factors. Given that ED after 40 is so strongly linked to cardiovascular and metabolic health, directly addressing these factors is essential. Blood pressure management, cholesterol management, blood sugar regulation, weight management. These aren't just general health recommendations, they are direct interventions for ED. A study published in the Journal of Urology found that losing just 10% of body weight in overweight men with ED resulted in significant improvement in erectile function in 1/3 of participants, without any other intervention. The metabolic health videos we've covered on this channel, sugar, gut health, superfoods, are all directly relevant here. Improving your metabolic health improves your erectile health. The same interventions address both simultaneously. Natural fix number 5. Reduce alcohol and quit smoking. Both deserve a direct mention because the evidence is unambiguous. Alcohol is a vasodilator in small amounts, but a vascular suppressant in larger amounts, directly impairing the blood flow mechanism of erection. Chronic alcohol consumption damages blood vessel walls, suppresses testosterone, and disrupts sleep. After 40, when all of these systems are already under pressure, regular drinking significantly worsens ED. Smoking is possibly the single most damaging lifestyle factor for erectile function. Cigarette smoke directly damages blood vessel endothelium, the cells that produce nitric oxide. Smokers have significantly higher rates of ED than non-smokers at every age, and the damage is dose-dependent. The more you smoke, the worse it gets. The good news? Studies show that quitting smoking produces measurable improvement in erectile function within months. The blood vessels can recover. It is reversible. I want to be very direct here because this matters. If you are experiencing ED, please see your doctor. Not because it's necessarily serious, but because it deserves proper evaluation. As we discussed, ED after 40 can be an early warning sign of cardiovascular issues that are genuinely important to identify and address. A doctor can check blood pressure, cholesterol, blood sugar, testosterone levels, and cardiovascular risk, all of which are relevant and all of which are treatable. There are also very effective medical treatments for ED, including PDE5 inhibitors like sildenafil, that work extremely well for most men and are safe when properly prescribed. These aren't giving up. They're not a permanent solution necessarily. For many men, they provide relief while lifestyle changes take effect and can be reduced or discontinued as underlying health improves. The conversation with your doctor might feel uncomfortable, but it is one of the most important conversations a man over 40 can have. Please have it. And if your doctor dismisses it or makes you feel embarrassed, find a different doctor. You deserve to be taken seriously. Here's where we land. ED after 40 is common, remarkably common, and it is not inevitable. It is not permanent, and it is absolutely not something to suffer through in silence. It is a signal, your body telling you that something needs attention, whether that's your cardiovascular health, your sleep, your stress levels, your diet, or your metabolic health. And when you listen to that signal and act on it, the results can be genuinely life-changing. For the men watching, you are not alone. You are not less of a man. You are a human being dealing with a biological reality that responds beautifully to the right interventions. Please seek help. Please make the changes. You deserve to feel well in every sense of that word. And if I earned a thumbs up today, go ahead and hit it. It helps more people find this channel. And on a topic this important, the more people who find it, the better. I'm Nate. This is Geek Your Health. Stay curious, take care of yourselves, and I'll see you in the next one.